Okay, welcome everybody. We are here on Star Wars Day. Happy Star Wars Day. And we're doing a video about how medicine is portrayed in Star Wars and how that relates to the real world. We have a couple of folks with us who have agreed to geek out with us and participate in this panel. We have Dr. Benjamin Abo, who is an emergency room physician, and Dr. Chivas Owle, who is a pharmacist. So welcome both of you, and thank you for agreeing to do this. What we're going to do is we're going to look at a couple of clips from different Star Wars films and TV shows and talk about how they are showing medicine's portrayal in those clips. Okay, so I'm going to go ahead and share here so we can all see this clip. Now, this one is from The Mandalorian, first season, and it's when Mando is talking with the IG-11 about removing his helmet so he can get medical care because he's gotten injured. So we'll go ahead and start this one.
No living thing has seen me without my helmet since I fully agree. I am not the living thing.
That's how I feel at work every day.
This is a Bacta spray. It will heal you in a matter of hours. You have suffered damage to your central processing unit.
So what I think is interesting about the Mandalorian clip is that that's something you really run into, right? As a physician, you probably do run into a situation where you have people who refuse to get medical care because of their religious beliefs or what their personal beliefs are.
Absolutely. I cannot go one shift without running into this, whether it's personal beliefs because of something that they heard on Facebook or, watched on some weird channel, or they heard from this person, or their religion. In fact, when I was in medical school, we used to have to do blood transfusions for certain people behind closed doors because they were Jehovah's Witness, but they wanted the blood transfusions but didn't want the church to know. So I call that the Jehovah's Witness Protection Program. But we get this all the time, especially during this pandemic. I get it all the time where they don't really know. It's just their way, and you ask them why, they say it's because this is the way, this is the way. And even before Mandalorian came out, they said, this is the way, that's just how I do it.
Okay, well, why don't we move on to the next clip. This one is of Luke and Leia's birth in The Revenge of the Sith, and some of the robots that are involved in Padme's care.
Medically, she's completely healthy. For reasons we can't explain, we are losing her.
She's dying.
We don't know why. She has lost the will to live. We need to operate quickly if we are to save the babies.
Babies?
She's carrying twins.
Been there.
Okay, well, here, I'll
First
take
off, she looks
this.
amazing for having twins, right?
Say what?
She looks amazing for having twins.
Yeah, she looks quite slender for being expecting twins, and
She
accepting the whole, she lost the will to live. I think what's interesting to me in that clip is you can see that all of the people who are taking care of her aren't people, they're droids. It's all droids. There's no human physician or nurse or any kind of caretaker. And if you think about the overall Star Wars universe, there's only a couple of times where we see medical care being provided by human beings. I think there's one in Rise of Skywalker where Chewie's getting taken care of by a human being, and then Leia helping out Luke after his hand got chopped off. And that was all I could think of. I mean, I might be forgetting something, but it seems like most care in the Star Wars universe is done by droids. And I guess, how much of that, I know we're moving towards more and more automation in healthcare, but how much of that are you seeing at this point in your career?
For me, it's scary foreshadowing, and it's tells us some of the trials and tribulations. You have things that they can be automated. Look at how many people go to, who are those two famous doctors? Oh yeah, Dr. Google and Dr. YouTube, where they go online and they answer some yes or no questions, and then boom, they're done. Or people think that they can replace pharmacists and physicians and PAs because they can follow a protocol or an algorithm, and we don't all fit in an algorithm. Most people don't fit in. Most of us, our bodies don't actually read the textbooks, so we don't really fit into it. So the automation or attempting to automate it doesn't make any sense, and it's kind of scary. But that's what they're trying to do, and I like it for a safety net. That makes sense. But the big push for the true full automation that's one of the reasons that reflex could just give antibiotics, because you think you have a fever, or you know somebody that had a fever 2 weeks ago, and then we build up resistance, or unnecessary procedures or misdiagnoses. That's kind of scary. And at the same time, it's very analogous for me to the Dark Lord of insurance companies. That they just, insurance companies and lawyers trying to mandate how to do healthcare, just is because they think this or they read that. Like, no, it's not this automatic reflex of, oh, my neck hurts, I need an MRI. No, you don't need an MRI. You're not getting an MRI. So it's kind of scary that it's kind of there now, and what people are trying to make it go towards.
I would say the good news is Star Wars doesn't seem to have insurance companies, so maybe there's some hope on the horizon for that. I feel like there's so much to unpack in that video, because I don't think it was Lucas's intention, but you point out that all of Padme's caregivers are robots, and I would argue that Padme gets really poor medical care. So she's a senator, so presumably she should get like the best healthcare imaginable in the Star Wars universe, but yet when it comes time to deliver, they're surprised to learn she's carrying twins. So what is gynecology like in the future that women don't know they're carrying twins?
Oh boy, what the, yeah. That's actually a really good point. And one of my thoughts initially anyway is sometimes the more technology that you push to try to technologically advance something, the more we backtrack. And if you actually look at most of Star Wars, medicine is mostly like wilderness medicine, or it's like going back to developing countries, 1950s and 60s medicine, that equivalence. And part of that is where, Star Wars was first written and when, but still it kind of carries on, and it's true because you can only take those tenets in our advances so far, but also trying to cram technology down our throats doesn't necessarily make it go through, no matter how advanced or how many dialects we can speak and translate into, like C-3PO. But, it doesn't really truly replace true intelligence as opposed with artificial intelligence.
I'd also love to get your thoughts, Ben, on Padme losing the will to live. Now, there's tons of fan theories that, like, maybe Palpatine was using a dark force power, and, there are some retcons that make it reasonable. But what do you think about her losing the will to live, and that apparently being the proximal cause of her death?
Yeah, well, first thing I think of is she should check in the couch, because when I lose things, it's always in the couch cushions, like my car keys. But also, I was actually really curious, like, in those words. Also, in terms of, like, how is a droid, determining someone has the will to live or not? Is it a simple yes or no question? Are they getting on that stupid, Wong score where it's like, is your happy face a 10, or scale of 0 to 10? 0 being nothing, and 10 being mauled by Chewie, with your arms ripped off. How do they really determine that? Or is that something measurable, like a fingerstick glucose test in the future? That would be kind of cool. But my personal thoughts behind it, and seeing every episode movie over and over, is that the sadness of what Anakin put her through really opened a door to the dark side, and that was the Sith's that's the true revenge. That's the true revenge of the Sith, and how they're coming on board and kind of really taking her over emotionally and opening that door. And once they got that shoulder in, keep that door open, it just unleashed. And so she just kind of no longer could see. It's like a horrible postpartum. She's got prepartum depression from the dark side. That's
from the dark side, yeah. Like everything else in Star Wars, it was the Force, right?
It was
the Force.
But I do think that that was part of the doing of all the Dark Overlords and Siths and everything. Really taking away that kind of all right, whatever. And not to mention, part of me also is just like, she's in labor. The things that women say when they are in labor, kill me now, I'm going to kill you, you did this to me. Ah! She lost the will to live. And then they take the pillow and they're just like, she lost the will to live. I swear, she said kill me now. She didn't mean it.
I know. I also think, and like you mentioned, postpartum depression is real, and I'm certainly not trying to minimize that. But I do think it's kind of interesting that they deliver the line essentially immediately as she's looking at her newborn twins, right? Like she names Luke, she names Leia, and then she decides that she has no reason to live.
That was quick. Now wait, I'm already forgetting. Did she lose the will to live before the kids came out?
I think it's actually after. Like they say she's losing the will to live, and then she delivers, and then she dies.
Yeah.
So maybe she got the will back.
She did not find the will to live in her children's faces. No.
No. Yeah. She was pretty quick on naming them too. That was pretty impressive.
Yeah, I think she must have had them ready.
Yeah. Well, and you said that they didn't know that she was carrying twins. She might have known. We don't have that knowledge in her, of what her medical care was. But I think that's a good point that that she maybe wasn't getting the best care there. One additional thing I wanted to ask about was, as far as how you envision seeing medical care in the future. I know that one of the big issues now is really information overload, that there's so many things, there's so many new treatments, there's so many different things that you have to be aware of. Is that a place where maybe you could see technology being like an assist to physicians and other healthcare providers and pharmacists, so that they have better knowledge and are able to say, okay, well, I don't know this, but I'm going to, go check this before I take care of you so that I can be sure I'm using the latest information. Is that a place where you see technology working with medicine well?
For me, I see it in two ways. One, it gives us a lot of options on how to do procedures or do certain things in different ways. I mean, that rescue that I was just on, I used the ultrasound on my phone to do a nerve block to numb his whole arm from the brachial plexus. Or I can diagnose things in the street. So that's like using technology as opposed to, I don't know, I wonder what's going on. I don't have a stick for you to pee on to tell if you're pregnant. Something like that. So one side is the actual procedures of being able to do things and gives us options. I can do a nerve block, or I can take your leg and just amputate. We can kind of see. On the other side too is part of grad school, whether it's medical school, pharmacy school, PA school, part of what we do and what we're learning is not just learning the medicine, it's learning how to read. Physician, the original words go back to, or doctor, one of the two, I can't remember, is the Greek roots, is actually teacher. So we're teaching people how to take care of themselves and make decisions, but also we're learning how to go through. So sure, there could be this great article that says if you drink 72 sodas a day, you can be healthier. But sometimes it takes a physician or pharmacist or a PA to look at the source and be like, this isn't really a good resource. This is Cosmo magazine, right? So how to tie it off. So there's all this great information out there, and it's almost information overload. But part of our training with the grad school still is, because we don't want to just put that information out. Look at how many people misquote things all the time, especially in the past 14 months. When they say, well, this study said that. You're not actually reading the study correctly. It's how you stress the syllable a little differently, and you get completely different meanings out of it. So we still need to know how to kind of swim through the information that's out there, but we can use technology to help us separate through that and get it to our fingertips.
Yeah, I agree with Ben. As our access to information increases, our access to misinformation increases exponentially faster. And I think having some framework with which to evaluate the validity of information is just priceless for any healthcare provider as well as just the general public.
Not to mention, there's misinformation and disinformation. I can easily make a website that makes me look thin and younger.
Can you do that for me? Laura, you were talking about, technology into the future. And I think most people, when they think of futuristic medical advances, they think of something like, the Da Vinci surgeon robot or advancement in that area, because the public doesn't see pharmacy as much. But there's actually a lot of technology in pharmacy, and automation is a pretty hot topic for us as well. And all I can say is everywhere that I have ever worked that has any sort of automated dispensing capacity where they use technology to dispense medications, just buggy, super, super buggy. There's no doubt in my mind that that's where the future is heading, that instead of going to a corner drugstore, you'll go to a corner vending machine. Or also inside the pharmacy, instead of having 10 people to fill a prescription, there will be, a robot and one person supervising, something along those lines. But I would say the current state of technology for pharmacy is the machines break down a lot. It requires a lot of human time to restock the machines, calibrate the machines, fix the machines when they go down. And all I can say is every robot I've ever worked with in pharmacy, I would have taken a person over the robot just any day of the week.
Yeah. On top of that, so I was just, when I walk into my ER shifts and I see one of the pharmacists, Justin, we don't, 24/7, we don't have an ER pharmacist or an ED pharmacist, but when I walk in, I see him, I'm like, praise the Lord. Because I know that there's a lot of things that I can bounce off of him for information, but also he catches things that I accidentally do, and I'm not killing people, but he helps me optimize care and also optimize education. And then at the same time, you have the automation, the data automation from insurance companies, this and that, where I've been on a medication for years, I'm healthy on it for years, but just because I changed the insurance company, they're like, oh, you need to try this medicine first. And so the pharmacist isn't able to fill it. I'm like, I used that when I was 10 years old, and I had all these horrible side effects. And now you want me to change medicines back to that to give it a try? Like, that's the other automation of the checklists. Well, you have to try this. That's kind of scary with things that I don't see anytime soon in my career true full automation taking away my lovely pharmacists.
We'll switch over now to our next one, which is the Luke's Hand. And this one I really like because it is something that we are actually able to do now. So I'm going to go ahead and start this one. Yes, here we go.
I don't know about
Okay.
you. I can feel the little pinpricks when they're testing. Like when I'm watching that, my hands are like kind of twitching a little bit.
Well, what I think is really interesting is there's also at the University of Utah, they have actually come up with a prosthetic robotic hand that attaches to nerves that you can move while thinking. And it's absolutely fascinating. And they call it the Luke arm because, of course, they're all, the people who developed it are all, were kids of Star Wars. And I think it's pretty impressive how they've been able to take something that they saw in a movie and that was just fantasy and is now, something that can actually help people's lives. And it's not as sensitive as a real hand. They can't do everything, but it's really very impressive. Yeah. So this is from University of Utah College of Engineering, and you can see there's the hand, and he's controlling it here with the computer, but they've actually attached it to someone who lost their arm nerve endings, and they are able to actually control it. You can see here it's attached, and he's able to, he was testing the prototype, and he can.
Wow.
And obviously it's not to the level of what we see in Star Wars, but it's really impressive. You could peel a banana, which is, a fairly delicate task.
Very appealing technology.
I'm sorry, Laura.
What?
That's incredible.
Yeah, it's really spectacular. I just think that this is, that's what you kind of want to see with science fiction and fantasy, is that you want to try and see that it is really inspiring people to do new things and think of new ideas. And I think that's one of the reasons why people find fantasy and science fiction an appealing thing to watch and to view and interact with, because it is something that gives you essentially hope for the future and of doing new things.
That even has a lot to show with, and you said the right word, inspiration. I think about how I grew up, how I was raised. I kind of refused to grow up, but art and just imagination and things was a huge part. And if we keep trying to fast track people into careers, what is that kind of doing? Because they're, they fall into these things and they don't realize what else could be there because they're go with whatever information's there. But if we can do whatever, whether it's movies or music and activities, stuff like that, to inspire and let people think. I mean, if you can, you see Star Wars and you're like, man, I want to make a prosthetic hand. I want to make a prosthetic leg, and then that's their legacy. But like my eyes are even rolling after that joke. Sorry. But the importance is inspiration to kind of take things and possibilities from movies and make it, whatever's needed for us and based on things. I am super curious how they, where were the nerve endings? Did they tie into, did they have to test and be like, okay, well, this nerve ending is kind of here or it's kind of here, and redo a mapping? Or would it be the same map for everybody? That's cool stuff.
Yeah, I just had no idea we were that far along. The idea of attaching robotics to nerve endings and actually translating that into usable information is really fascinating to me. Also, just like how.
Yeah, it's really, I think it's really spectacular. I think that's probably my favorite of the Star Wars medicine crossover things that we've seen. So
I also think, like, in the Star Wars universe, Luke is like a farm boy, so he can get his arm replaced. How much of a prior authorization do you think you would need to go through to get that robotic arm today? Well, once it's released.
Well,
yeah,
he needs, you know, it can't be all automated too much and stuff because, you know, he'd have to like use the Force. Like, you will pay for this. You will reimburse this. You will pay this.
He can use the other arm.
But yeah, well, you can't use the other arm if it's a droid or machine, right?
True. Oh, that's true. Oh, man.
So if all healthcare is just suddenly automated, like all aspects of healthcare, ruh-roh. Now, what do you think is more realistic or more tangible sooner? Star Wars medicine or Trekkie medicine?
I would go with Trekkie medicine just because if you think about like the tricorder, I mean, like you said, you have the cell phone, you have the ultrasound ability on the cell phone. You know, the communicators that they had are basically iPhones are as good or better than what they had on Star Trek. You know, I think that because it was a little more hard science fiction versus more of a fantasy. I think they extended what we have now a little more logically because they said, okay, they were going, you know, 500 years in the future, you know, and they extended it versus a separate galaxy somewhere else that we don't know all the history of the development of the galaxy.
That's a really interesting take, and I think it's exactly the opposite. Because when I think of Star Trek, I think of like a holographic doctor, right? Or you get put in a scanner and it can scan for literally anything and fix you no matter what the issue is. And even though Star Wars is definitely the more fantastical universe in terms of fantasy, I feel like their medicine is much more grounded in the sense that they're using robots, not holograms, you know, devices. I don't know. You make some really good points, though. I'm going to have to think about that. What do you think, Ben?
I go back and forth. You know, parts I'm like, well, I got an iPhone. I got an ultrasound. I mean, I was just out filming. I was on the island that gave Michael Crichton the idea for Jurassic Park, 300 plus miles off the coast of Costa Rica. We're filming Shark Week, and I'm like, I'm 40 hours from the nearest hospital, but I got my phone with an ultrasound. Like, that's pretty, like, baller, so I can do different things and automatically be like, measure the volume of your bladder. Not that I have any use for that, but they made it so I could do that. Great. You know, but then other times it's like, it's, you know, the realism of a robotic as opposed to like a droid doing things. And they're always fixing those droids, right? We're always, our CAT scanner is down all the time. We got to fix this. We got to fix R2. We got to short. And then you're like, I don't know, I got to fix something. Scotty, what do you never really actually see him do any work. He just talks about doing work. But they're always fixing the droids, kicking it, doing a little bit of duct tape.
Yeah, what's more realistic than banging something on the side to get it to work?
Right, yeah. So they go back and forth, which is more realistic. And that's actually why I was really curious what you both had to say on that.
So, Laura, is this video going to have comments? If so, tell us in the comments below which future is more realistic.
I want to know.
Yes, there will be comments on this video, and I think that's probably a good place to wrap up. I want to say thank you to Dr. Owle and Dr. Abo for their time and indulging us with this discussion of Star Wars and medicine. Hope everybody's
thanks for having me. It was so much fun.
Absolutely. Thank you for having me, and you know, may the 4th be with you. May you enjoy Cinco de Mayo, and hopefully not too much that you get the revenge of the 6th.
Sounds good. Well, thank you again. And if you enjoyed this video, please let us know in the comments below. And also, if you want to see more videos, you can subscribe to our channel. So again, thank you, Dr. Owle, Dr. Abo, and may the force be with you.
May the force be with you.
May the force be with you.